Well, hello everyone. Thanks for being here, whether you're here in person or virtually. My name is Lindsay Kearns. I'm with the ALS Association as a Care Services Coordinator. I'm excited to be here. Again, thank you to Life Pro Financial Services for always being an awesome host and letting us be here today. And then I wanted to welcome Gil and Danielle from UCSD to talk a little bit about an update on the clinical research with ALS. So take it away.
Thank you. Go ahead, Danielle.
My name's Danielle Bussey. I'm a study coordinator at UCSD. We're just going to tell you a little bit about clinical research, about some of the options that are at UCSD, and then some of the options that are online or at other sites as well. So, Gil, do you want to introduce yourself by last name?
I am Gil Gutierrez. I'm also a clinical research coordinator with Danielle. Work at the UCSD Clinical Research Program for ALS. And we can go ahead and begin.
Okay. So we're just going to go over the basic common definition of clinical research and then why you would do it. So clinical research, by definition, is just a branch of the healthcare system in science that determines the safety and efficacy of medications and devices that can help in treating a specific disease or condition. Why do you do it? There's benefits as far as, if there's a disease that doesn't have a cure or treatment, that's what we're hoping to develop. And you're also just providing more information about whatever specific that disease is or what condition that is. In that case for ALS, there's no treatment. There are drugs that can slow progression that are out there currently, but there's no, treatment, no more ALS if you take this drug. So that's what we're working to develop in research and just better living and lifestyle for our patients. Colette, you take this one.
So what is ALS? Sporadic versus familial. So sporadic ALS comprises about 90% of the ALS cases. Familial ALS is actually familial, meaning that there's a gene that actually can get transferred from generation to generation. That's about 10% of the cases for ALS. And typically, the most common familial ALS would be SOD1 and C9. So, and then also, let's see, motor neurons are actually, ALS, kind of going back a little bit, motor neurons are actually the cells within the muscles that actually over time would die off with ALS, because the communication from the brain to the motor neuron cells over time with ALS, they are compromised and eventually they cease to function.
And let's break down that word really quick, amyotrophic sclerosis. So the A in the word means no, myo means muscle, and trophic is nourishment. So there's no muscle nourishment occurring. When that occurs, so let's say there's messages that are sent from your brain down your spinal cord on a daily basis, triggering voluntary motion. So when that communication gets broken and that muscle is not activated, it paralyzes. There's no nutrition going to that muscle, and that's what causes the sclerosis, that hardening of the muscle and that loss of motion. So that's the foundation of ALS and what is occurring on a daily basis. So as far as voluntary muscle, that would be breathing, speaking, trying to grab something, stepping up on a curve, any of those. It's not non-voluntary muscle. So it's not, as for instance, cell metabolism or things like that. So often your sight isn't affected, your senses aren't affected, your hearing, your smell. Those are things that aren't usually affected with this disease. We're going to give you a little bit more in-depth description of sporadic versus familial in the next slide, starting with sporadic ALS, also called SALS. Sporadic ALS, there is some differentiation between men versus women. In research, it's that men have about a 20% more chance of getting ALS. Also military, based off the average, or compared to the average person, has twice a chance of getting it. They don't know why this is occurring. There's research being done in it, specifically with the Gulf War. A lot of veterans in the Gulf War have a higher chance of getting diagnosed with ALS. Age is also a confounding factor. As you grow up in that age range, though, the gender between men versus women, it's not that 20% increase in men having ALS versus women grows weaker and weaker. So there's not much variation between gender. There are about 6,000 people every year that contract this disease, so it is still considered an orphan disease. It's a rare disease, so it's vital that research goes into it and awareness goes into it, because a lot of people still don't know what ALS is. Do you want to talk about familial?
Familial, yes. We're basically mentioning that before. Familial ALS actually occurs within 5 to 10% of all cases that are diagnosed with ALS. And I was mentioning before that the two most common type of genetic mutations for familial would be SOD1 and C9. And essentially, the people that have sporadic ALS experience the same type of symptoms. It's just that the familial cases is actually a mutation in the gene, where sporadic is exactly what it is, sporadic. There's no known reason why it is occurring, versus the familial, which is definitely a gene that's transmitted down from generation to generation. So obviously for familial cases for falls, there is genetic testing that's available that would be able to identify the gene mutation, and that's through genetic testing through your physician, your neurologist, that would be able to identify and let patients know if there's any instances of potentially having familial ALS. So that is something that could be notated and genetically, with the report, able to let the patient know that it could be a gene mutation SOD1 or C9, which are the most common familial ALS.
There are a couple other gene mutations listed on here, the TDP43, FUS, and the UBQLN2. It's so vital to do genetic testing in this. There's about 50% of familial cases that do not have a gene linked to them. This means that you can see grandpa had ALS, the father had ALS, now the son has ALS. They don't have a gene identified to it. So it's important to get this genetic testing done so that you can get more and more results, and hopefully you can track, this person has this gene mutation, this slight biomarker change. There's some relation and correlation, and more research can go into it. And hopefully we can learn more about the disease and develop a drug or some type of therapy that can target that gene. So genetic testing is very important, even in sporadic cases. I'm going to tell you a little bit about the National ALS Registry. This is an important registry. What you can do is you log on to cdc.gov. One of the options you can do is to actually apply and log into the registry. They ask for a risk factor survey, which takes about 30 minutes. They'll ask you to give information on your gender, your age, work history, environmental history, all these things that could possibly be causing the ALS, things that could be connected to ALS, or why this gene's mutating or have some connection. Once you are logged onto this register and you've filled out your information and completed that profile, you have availability to a lot of resources. One of the main ones is you can watch videos on ALS. You can get access to publications, very new publications on ALS and new findings. You can get access to support groups that are local in your area. Also, you can get access to clinical trials that are going on. It provides you with a huge amount of resources. On top of, you can actually order fact sheets about ALS, fact sheets about planning for the future with ALS. It's just a huge symposium of information for you to have. The main point of this registry is to basically collect a census of how many people have ALS. So it's estimating how many people contract ALS every year and how many people have it in total. So seeing how much of this population has ALS, because that's important. It still is an orphan disease, so, you know, you get into kind of the politics of business and the medical field, and with orphan disease, there's more funding with diseases that have more patients. That's the sad part of it. So it's important to apply to this. Also, so they can do more research and find biomarkers and risk factors that we don't know of that could be causing ALS.
And there's also the Rare Disease Clinical Research and Network Registry, which is this next slide, and that is actually meant to kind of accommodate the National Registry for ALS. So this is actually a site that would support and enhance the National Registry, and it almost does the same thing. Collection of information connects you to different clinical trials, which we'll be talking about another clinical trial, the PGB CREATE study, which is under the auspices of the RDC RNR, which is the Clinical Disease Clinical Research Network Registry. So it does almost the same thing. It's not meant to compete with the National Registry, just to enhance it, to provide more resources, share information, hook you up with the medical community, patients as well. Danielle was talking about the resources that are available. I think most importantly would be the clinical trials that you would be able to get access to through the RDCRN, which is really important. I think that's probably the best benefit that you can get from that. Is it's going to really enhance the CDC registry. They're meant to work side by side with each other.
And the cool thing about the RDCRN is you can actually click a button that says share my information. What that allows you to do, it's still, you know, de-identifying your information so that it's not leaked to anyone that doesn't need it. But this allows physicians and patient advocacy groups to see your information and possibly link you to a study and contact you for a study that you might apply to. You don't have to click it. You can still fill out the profile, register on this website, and not share your information and just scan by yourself. Or you can do share my information, and you can actually get a chance to get reach out from other physicians and study coordinators that might be enrolling for a study.
So I was talking about the RDCRN. Under the auspices of that, this is a study that is currently being offered at the UCSC ALS Clinical Research Program. It's the CREATE study, the PGB study, phenotype and genotype study. It's a NIH-funded, non-therapeutic, longitudinal observational study over the course of about a year and a half. It consists of 5 in-clinic visits, and some of the assessments that we're actually doing, as you can see, respiratory assessments, verbal assessments, quality of life questionnaires, biofluid collection, blood, urine, and CSF, and that is completely optional for the patient. And the benefits are actually to gain more information about ALS, ALS-related diseases. Yes, Keith?
Can you give me that in English? Some of the acronyms, and then the first 2 words you said, I don't know what they meant.
PGB. So the CREATE study, it's the CREATE study, but the formal name is PGB study, meaning phenotype and genotype. So phenotyping is actually the signs and symptoms of the disease, and genotyping is the genetic information from the patient. So which are 2 things that are really critically important for ALS, because ALS doesn't have a lot of good science behind it. So this going forward can help collect information, develop a repository for in the future that could help, like Danielle was saying, help with methodologies, therapies, drugs in the future. So getting that good baseline information and using that to go forward with the disease to help individuals with ALS.
And you might have said this before I came in. There are no exclusionary things to this one. Is this one universal, or?
It's a very inclusive study. It's a very inclusive study. So the likelihood of getting in is, very high. If you have ALS you have a clinical diagnosis for ALS or an ALS-related disease, which could be PLS, primary lateral sclerosis, HSP, PMA, sister neurological diseases under that same umbrella for ALS would qualify for this study. So it's very inclusionary.
The only exclusionary criteria would be in the rare case that the physician comes to that baseline visit and, it's more of a tax on you than a benefit.
Right.
And so that's if you're, unfortunately reaching the end and respiratory's taxed, and it's harder on you for you to come to those inpatient visits than if you just, maintained your health and, kept all your energy. I did forget, now that you brought up blood donation, going back to CDC really quickly, one of the cool things about this is they also have a biorepository. So their biorepository collects urine, blood, and saliva. With those genetic samples, they can, look for specific biomarkers. I believe they just found a biomarker, I'm forgetting the exact name of it, but it was from a urine sample. I'm forgetting that name, I should have wrote that down. But there's a lot that you can do with all of these samples, and those biomarkers and those genes are vital in seeing, where this disease is coming from. Because there's a lot of, no one knows. No one knows exactly what's causing it, what's causing these motor neurons to die and this communication to be broken and this muscle atrophy. So that's just another option for this National ALS Registry. They have their own biorepository.
So a biomarker, just to kind of throw it out there, is, say for example, if you use another indication like high cholesterol. High cholesterol has several biomarkers like HDL, LDL, triglycerides, etc. So there's really no biomarkers in ALS in that same regard. So that's something through the repository that they would actively be looking for, those type of biomarkers in that vein.
Sorry to jump back. I'm just going forward. There we go. Okay. So just to reinforce with CREATE before we skip up that one, that is a non-therapeutic study. So it's a symposium of data. The benefit of that is solely for research. One of the things that this study does offer is genetic testing. That first blood draw after you do your screening, which is, about a 2-hour phone call where we're just collecting information on your familial background, some medications you're on, any surgical operations you've had that might, impact the disease. After you come to that baseline, that first blood result will be for getting that genetic testing done. That takes about 6 to 9 months, but that's, it is a benefit of this study to have free genetic testing since it can get pricier. Yes.
So how extensive is that genetic testing versus what I hear to be like a $6,500 genetic test?
It's exactly the same thing, except you're getting it for free if you participate in the study. So what they're going to do is they are actually going to identify any of the mutations that are under the auspices of ALS, any of the other related neurological diseases that we mentioned before, PLS, HSP, PMA, all of those known biomarkers, genes, will be inclusive in the report for patients. And then the benefit is once you go through the trial is that you have the opportunity to work with neurologists. Dr. Ravitz, some of his fellows, neurological fellows that work with him, would be able to talk to the patients about the report, be able to interpret that. And the benefit of asking questions directly from a neurologist is, I think that's a great benefit for patients.
So this is huge.
Yes.
Mm-hmm.
I mean, because just a few years ago, if you wanted that testing, it was $6,500, every penny of it.
It's very pricey.
So that's huge. For our online audience, which there's quite a few today, and those who watch it later, big point, genetic testing included at no charge.
Correct.
Plus all the extra exposure to the neurologist.
Yeah, and you're getting more results than you would. So you're getting respiratory results every 3 months. You're able to track that. There's cognitive assessments. There's the ALS-FRS, which is a function rating scale. So it's measuring how your function has changed since your symptom onset of ALS. So there's all this extra contact and extra result you're getting to track your progression. So that's important. Yes, Keith?
Fantastic. So since you mentioned the functional rating scale,
Okay.
I'll speak for those in the audience that can't call in.
Sure.
I'm on Radicava. Can I still do this?
The CREATE study?
Yeah.
Of course you can.
Absolutely.
I just wanted to get that out there. If you're taking any drug, there's only 2 FDA approved for ALS.
Right.
Doesn't matter. You can still submit to this and probably be
Yep.
accepted.
There's
Absolutely.
no active therapy for this study. So this study is just collecting data, basically. So,
Right.
very important.
Great question. Thank you.
That was a good question.
Yeah.
Okay. So, do you want me to talk about Mallinckrodt? All right, so Mallinckrodt is our newest study that we're enrolling in at UCSD. This is a therapeutic study. It's HP Athcar gel, which is a steroid. It's a subcutaneous injection that would take place daily. For this study, there is inclusion and exclusion criteria, meaning, there's certain criteria you have to meet to be in the study. So one of the big ones is respiratory function. There has to be a respiratory function greater of 60% at that screening visit. Also yes.
So to translate that, if you already have a BiPAP, you may already
So,
be. You check the numbers, but is that like a good way to know if I should apply?
not necessarily. So the thing with the BiPAP is there cannot be required continuous use of the BiPAP, meaning if you come off the BiPAP, your respiratory function drops below 50, you can't breathe. It's needed for survival at that point. So if you're on a BiPAP and you're using it intermittently and it's more, I walked a couple blocks a day, I needed to catch my breath. My respiratory function did not drop below 60%. It was more at 70. You're not excluded at that point. So it's that continuous required use, and especially at night. If you're using that BiPAP continuously at night, then that is exclusionary. As far as symptom onset, this study does have, so your first symptom cannot be more than 2 years from your screening visit. That is a harder exclusionary criteria, being, there's cases which, we've mentioned in the past where, you had weakness in your ankle that happened 6 years ago, and it could have been ALS, it could have just been weakness in your ankle, and that's an unfortunate case of these studies. But it is, a study. We're testing efficacy right now, so this has been run for safety measures. So this dose, now we're switching over to efficacy. So does this drug work? Is it slowing progression? Right now we're enrolling. What happens is you'll come in for a screening. This is a 9-month study. If you do pass screening, so there's negative results that are needed, so negative hepatitis, negative HPV results. Diabetes is not allowed on this study since steroids can, throw your sugar really out of whack. Do you want to add something to that?
Just going to say that the screening visit for this study is 28 days. So once the person does a screening visit, they have to do the baseline visit within that time frame. And then Danielle was actually mentioning that there's other blood tests that would need to be checked to ensure that the patient's actually okay to continue forward with the study. So those are the main points to meet to coming into the screening visit, which are very important. But there's additional blood testing that would need to be executed, and we need to get those results back to ensure that the patient would be okay to continue forward. So that 28-day period is crucial for the screening and the baseline visit.
Okay, so I'm watching this right now, live, and I think I qualify. What do I do right now? Call you, send you an email, drive over to La Jolla?
Yeah, you
No,
Now I'm
don't
excited.
drive over to La Jolla first.
Don't drive to
do
La
that.
Jolla. Okay.
definitely call us. You can call us.
Yes. I put our emails up on the screen. It's the last slide.
Gotcha.
That's probably the best way to contact us, just because phone calls,
Okay.
It
Can
can
we go
get-
back to that slide for a minute? 'Cause
it's
this
the
is-
very last slide, but yes,
Yeah.
we can go.
Just so people who want to do it like right now,
Sure.
Yes.
if
so,
you think you're good for that study, I don't mean to sound like an online telethon, send your email now. Go ahead.
But
so
it could
those
be.
are all three of our emails. Another one of our study coordinators is going to be here. That's Rose Frevity. That's her email at the top, then Gil's, then mine. So you can contact any of us, and we'll try to get you ready for a screening, ready for a
Absolutely.
visit. So yeah. The other thing about this study is it's a double-blind phase. So what does that mean? It means that you have a 67% chance of receiving the actual drug and a 33% chance of receiving a placebo. So this is done in many study trials to test, is this drug effective? If we just put all of these people on a dose of this drug, how are we able to compare the results? So the placebo is just to make sure that it's not having any psychological effects. You're not just saying, oh, I feel better. It's actually testing, is this delaying progression? After that 9-month double-blind dosing, meaning you don't know if you're receiving the drug, your physician doesn't know if you're receiving the drug, study coordinator doesn't know, the only one that knows is the pharmacist. After that 9-month period, and if there's no significant, adverse events, nothing goes wrong, or it's not causing you any terrible side effects, there is an additional 4-month period of open label dosing. So that means you are for sure getting the drug, and now we're testing how it's working on you. So that's one of the benefits of this study also. Do you have anything else to add? No, we're good.
That's perfect.
So Gil's going to talk about the UCSD biorepositories.
So the UCSD biorepositories, in addition to Dr. Ravitz actually providing clinical care at the ALS clinic in Hillcrest, he also has several biorepositories. So what is that? Biorepositories would be, as you can see here, blood, CSF, which is cerebral spinal fluid, CNS, and also there's also another one called skin biopsies, essentially. So blood. What's the purpose for the biorepositories? These are active donations, so we'll start with blood. If what we offer is a blood donation, it's a consent for a clinical trial. It's really a blood draw to consent to give your blood, small little 12 tubes, about 72 milliliters of blood to Dr. Ravitz and his associates that are examining neurodegenerative diseases. So we were mentioning biomarkers. There's really no biomarkers. So this is actually really crucially helpful to get more information behind biomarkers to identify them in blood. That could help with, to gain more science and knowledge behind the disease. And what he does is they're stored at UCSD, and they will be utilized at some point in the future for scientific discovery through different types of testing to help with the progression of science, essentially. Any questions regarding the blood? And then the CSF is actually the exact same thing. Spinal fluid from the spine, used in the same manner to help, to help create more knowledge behind the disease. And I think the CSF is really important because it's actually coming from where the disease is active, the brain and the spinal cord. And I know Dr. Ravitz has mentioned that is probably one of the most important places to find the discoveries for ALS is in the CNS. So this fluid's actually really important. Again, it's a consenting process where I would go out, Danielle would go out and talk to the individuals if they're interested in making those donations, either for blood, the CSF, in addition to the CNS, which is a post-mortem donation, after post-mortemly, a donation for the brain and the spinal cord, and that would be a very generous donation, and I think a lot of good can come out of that, as far as really unlocking the secrets to this insidious disease going forward in the future. So, and I know that our team takes that very seriously, and we're very grateful for those types of donations, because I really think going forward that's really how we're going to unlock the secret to finding some type of therapy, methodology, cure for ALS. And with the CNS process, that would be something where I could, consent in clinic. I could go out to the house. If there's any individuals that are interested in making that type of donation, I would be able to facilitate that, coordinate that, and then talk about the logistics of transport, et cetera, that go behind the CNS donation. And why do it? I guess I kind of went over that a little bit, to advance scientific discovery for ALS and ALS-related diseases. And again, how do I do it? It could be following up with the information that you've already gotten. With our email addresses, you could definitely outreach to one of us. If there's interest, you can email me, email any of the team, and then we could go forward about coordination and how we would make that type of donation possible.
Is there a frequently asked question, like tab or something online on this, or, let me just cut to the chase. So I have my advanced wishes defined, and my preference is to have an open casket ceremony. Does this affect that at all?
That's a great question. So you're talking about the CNS donation. So there is very minimal, the scarring is very minimal. And if a family has intentions of doing an open casket, open viewing, it's not going to impact that at all. So there's no disfigurement to the individual, and that's something that could still be done. Any other questions? Keith?
Okay. I do want to make sure that this next slide, take down our information. This is a couple studies we currently have open. We're going to be, I think, getting a couple new ones in the next year. So we're not able to give you any more information on them, but keep our information. If you want to give us your contact information, we're more than willing to see if you apply to any studies here now and in the future. It's our duty to, serve you as patients and hopefully, make some breaks in this disease and, find a treatment.
Oh, one other thing too, for the familial ALS cases, we do have a study available, it's an ASO study specifically for the SOD1 mutation. So if there's any individual that has been diagnosed with the SOD1 gene mutation specifically for the ASO trial, you can definitely call. And what that is a trial that's specific for that gene. ASO trial is actually like a gene therapy trial where it's actively trying to replace essentially the bad part of the gene, replace it with the gene therapy, and help to see if it has an effect of slowing down the disease. Excuse me. So that's also available for individuals that have been diagnosed with SOD1 mutation. And I think Danielle was actually alluding to the fact that we are having additional trials that possibly could be coming available. So I know that there may potentially be another one for an ASO trial for C9 as well, which is another common familial gene mutation. So if there's any interest in SOD1 currently, or definitely you can contact us as well. So.
All right, well, thank you so much. I just wanted to give a last quick bit. Does anyone else have any other questions? Or no?
Quite well. It was covered quite well. I took a few notes and contact information. We'll get back with you.
Sure. Awesome. Well, thank you guys again for just taking your time and explaining more about just the clinical research update. One thing I wanted to share too is with the CDC registry, and I know you guys mentioned this before, I just wanted to send a reminder for whoever is listening or for us here. That's a huge opportunity to give your data and a little bit more about your own background and your experience with ALS to promote research and to really kind of do your own, what you can add to finding a cure. And I think that would be awesome to go and just check in with the CDC, cdc.gov. It takes a few minutes to just initially sign up, and then there's a couple of stages of questions and questionnaires for that. One thing that we're doing with the ALS Association is at Society Brewing. This is going to be Wednesday, March 21st. We're doing a lot of things to help just with you register with even SDG and E discount program, your walk team captains, and specifically we want to just promote what does that look like to sign up for the cdc.gov. So anyway, that'll be at 1 to 7, Wednesday, March 21st. So I just wanted to do a shameless plug there. And
Kearney Mesa.
oh, and Kearney Mesa, sorry. Yep. So yeah, hope to see you there.
Why is it important?
Oh,
You
CDC.
covered it earlier.
Oh, Keith was asking why is CDC registry important. Two biggest things I would say is one, your data does matter. Your story, your experience, your background really is going to help find a cure. Secondly, it's going to show clinical trials that are relevant to your situation. So a lot of people have asked me in the past. Did you
I
want
got
to?
another one too that I think is really critically important. Is if CDC doesn't know you're out there and you don't register, I think it's crucially important for funding as well to provide funding back to the programs, to let them know that there are people with ALS, ALS-related diseases, and how crucially important it is to register to get that extra funding to ensure that potential therapies, clinical trials for this population is available. I think that's an important point.
Yeah, that's great.
So, Gil, thank you. That's kind of where one of the things I was going with. Right now, we have Advocacy Month in May, where people from all across the nation at the different chapters will be going to Washington. And they have preliminary meetings coming up in March. And one of the issues that's kind of been talked about is the data. Center for Disease Control provides Congress with the numbers. If we're not in there, our numbers are lower, and it affects us greatly as attempting to get assistance and resources to fight this disease. So it's that whole thing you just said, Gil, is right on and so important. And the issue is hitting us right here in California. The Center for Disease Control is very private about the information in their database, obviously. But we have a rough idea of how many people in California, for example, or across the nation, statistically should have, unfortunately, this situation with ALS. Center for Disease Control looks at their registry, and there's a huge gap between what the scientific statisticians tell us the number should be and how many people are registered. And it's a big enough gap that's causing a problem. So MDA, Muscular Dystrophy Association, the ALS Association, and hopefully anybody else involved in these neuromuscular diseases is encouraging everybody, please register. It's really important.
Absolutely.
Thank you.
All right. Well, thank you all so much for joining us, and
Thanks for having us too.
Yes,
Yeah.
thanks for having us.
Thank you.
Thank you.
You want to plug next month? You're still live.